Hey guys, what if I told you that there is a way to restore the cushioning on the bottom of your foot? Maybe you're dealing with some heel pain right now or pain on the ball of the foot, all the cushioning is gone and you're at your wit's end. Well, stick around. We're going to discuss something known as the Leneva foot filler injection. This might be the video you've been waiting for. This is a phenomenal solution to a lot of aches and pains that a lot of patients deal with. Stick around, we're going to dive deep right now. Hey everybody, welcome back. This is Dr. Ashim Wadera, minimally invasive foot surgeon and regenerative medicine specialist. We're going to be talking about a fantastic modality known as Leneva foot filler. This is making waves right now across the world. This is a foot filler. You're probably wondering, who uses foot filler? A lot of people do, and it can save a lot of pain and save you a lot of agony. Maybe you're looking to get back into those nice heels that you once were able to wear, but you can't anymore because you've lost a lot of cushioning on the ball of your foot, or you're just having really painful feet for whatever reason. We're going to talk about all this right now, and perhaps this is a perfect solution for you. Okay, so what is Leneva? What exactly is it used for? Leneva is fat grafting injection that is specifically used to replace the fat that you've lost in the bottom of your foot, specifically the ball of the foot or even in the heel. As we get older, it's actually very normal to lose the cushioning on the bottom of your foot. We've come up with a way now to replace it so that you feel comfortable. Oftentimes, the natural cushioning in the bottom of the foot has been lost, and this can lead to significant discomfort, especially when patients are standing or walking for a long time. Think of the fat pad of your foot like your favorite cushion or your favorite chair. There's cushioning in the chair, and over time, over many years, you notice that the cushioning has lessened in that chair. So you can either replace the chair or you just can go ahead and buy a new chair altogether. Well, unfortunately, you can't buy new feet, but we have come up with a way now to replace the fat inside your foot. And again, that will help cushion the areas from discomfort and allow you to wear certain shoes that you haven't been able to wear in a very long time. All right, guys, so you're probably wondering, how does this stuff actually work? Well, Leneva is made of allograft adipose matrix, which is just a fancy word for saying it's been derived from donated human fat. It's been stripped of all the cells, and all that's left is now a scaffold. And so that scaffold is injected to the area where you're having an issue. Let's say the bottom of the foot. Well, what's really awesome about this product is that once it's injected inside your foot, your body actually starts to now lay down its own fat. So it literally will start to regenerate itself. But the cool thing about this product is that you're going to feel it right away. So maybe you're dealing with some really significant ball of the foot pain, very prominent, and you're at your wit's end. We can place the Leneva injection inside the foot and you'll feel the cushioning right away. But over time, your body is actually working behind the scenes and actually laying down its own fat so that you're constantly laying down extra cushioning. So when Leneva is injected in your foot, it actually encourages your body to lay down its own fat. And over time, it'll rebuild itself and rebuild that cushioning in your foot, reducing all the pain and discomfort that you might be feeling. So you're probably wondering, how does the procedure actually work? It's actually very simple. So we do everything in our office, and it's done very minimally invasive. It's a little injection that will be done. What we typically do is we'll numb the area with a little lidocaine right before the actual injection. The injection comes pre-manufactured from a lab, and it takes no more than 2 minutes to do. So once the area is nice and numb, I'll go ahead and inject the adipose tissue or fat grafting right in the area that we need. So most patients will find the procedure pretty tolerable, minimal discomfort. Again, we try to create a very peaceful and comfortable environment right here in our office so that there's no anxiety. The wonderful thing about Leneva is that it's not just a temporary fix. It's actually something that is utilized for long-term success. Again, as I alluded to earlier, when injected in the body, your body's smart. That injection signals your body to lay down its own fat. Remember, this fat that we're injecting inside is actually a scaffold. It's scaffolding for your body to lay down its own fat. So over the next few months and even years, your body's going to lay down its own fat. So you have a nice plump fat pad. Again, like the cushion on your chair. Maybe you're sitting on a chair right now and you're watching this video. That chair, imagine that chair, that cushioning as the bottom of your foot, the cushioning of your foot. Imagine that we're able to replace all that fat so that you are feeling comfortable, almost like walking on a cloud. Now you're probably wondering, is Leneva right for you? Fantastic thing about Leneva is that it's meant for most patients. We utilize it in all age groups, from young to even our geriatric population. Especially those who spend a lot of time on their feet. Maybe they're walking, they're standing a lot, maybe they're doing a sales job, they work in a factory, at their wit's end. They've seen other doctors and all they've been recommended is maybe something over-the-counter insert to put in the shoe or a surgical procedure. And maybe you've already tried orthotics in the past with little success. Maybe you've tried some pain medication, haven't found the relief you're looking for. Leneva really could be the game changer that you need in your life. Many of our patients that have had the Leneva injection have reported immense relief right off the bat. It's completely changed the quality of their life. Patients that love to golf who could barely sit in the cart to play golf are now walking 18 holes. Imagine that. Pickleball players who could barely play pickleball because of the pain they're dealing on the bottom of the foot. To the lack of fat, they're now back to playing pickleball or tennis and what have you. So again, the idea is that we are utilizing the body's own healing potential and just jump-starting it. This is what regenerative medicine is all about. So again, we're putting fat in the area that needs fat, and the body is now signaled to lay down its own fat. It's pretty amazing what this product can do for our. So after the Leneva injection is performed, it is typical to feel some soreness for a few days, but that dissipates quite fast. Patients are going to be placed in a walking boot for 2 weeks, and that walking boot is going to allow you to stay mobile, but also allow that area to basically calm down. It'll keep the fat where it needs to be. And so after 2 weeks, patients get right back to their regular shoes. Oftentimes we are pairing the Leneva injection with a nice custom orthopedic insole that's created just for your feet so that you're getting the best treatment solution for your needs. So let's talk about how Leneva is different from some of the other treatment modalities. A very common modality that's used in offices is a cortisone shot. And so if a patient like yourself who's maybe dealing with pain on the bottom of the heel or the ball of the foot, you go see a doctor, they may offer you a cortisone injection. And after the injection, you may feel pretty good for a little bit. The problem with that is that it's just masking the pain. Steroid is not healing anything actually at all. It's actually just a Band-Aid that's being put on your painful area, but it's not doing anything to help heal from within. Oftentimes it actually makes it worse because you're masking the pain and you're still going about your activities, but you're continuously damaging that area. Also, it's not replacing any fat whatsoever. And so a steroid is actually known to thin the skin and thin the area out. So that's actually working opposite of what you want. So again, Leneva is going to target that area that really needs cushioning. Instead of masking the problem, it's going to cushion the area up. It's not going to mask the problem. It's actually going to treat the root cause of your issue. Sometimes people want to know about PRP. PRP, good modality. I actually encourage you to watch our Wharton's injection video if you haven't seen it already. But PRP, again, along the same lines, PRP is a decent anti-inflammatory agent, but again, if there's no cushioning, it's going to just continue to come back. So again, we need to treat the root cause, and that's exactly what Leneva is doing. If the patient doesn't have enough fat in the area, we certainly want to cushion that area up so that the body now is signaled to create its own fat over the next months. Cushioning the area will allow the patient to get back to certain shoes that they want to wear, especially heels. Women love heels. Women come to me all the time asking me for some solutions. This is a phenomenal solution for women that want to wear heels, but just can't anymore because they're so painful. So guys, in summary, Leneva foot filler injection offers a minimally invasive, long-lasting solution for those that are suffering from a condition called fat pad atrophy, also known as just loss of fat related to foot pain. So if you're dealing with discomfort in the ball of your foot or even at the heel itself, this might be what you're looking for. Come see us in the office. You'll see a link below in the description for a consultation. I work with patients all over the world. And even if you just want to have a conversation, I would love to help you out. So leave any questions in the comments below. I do appreciate you watching these videos. The idea is we want to get the message out there that you don't have to deal with foot pain and you don't have to pump your body full of harmful chemicals, which is what steroids are. We don't need that. We have a lot of great, beautiful modalities out there that are healthy for you, that won't hurt you, that don't have side effects. Well, I should say that have minimal side effects, and actually treat the root cause. Again, here at the Art of Foot and Ankle, we're not about throwing band-aids at anybody. We want to treat from the root cause. And once you treat the root cause, it does a lot of great things for our patients. So guys, again, thank you so much for watching this video. Don't forget to like and subscribe. Again, we want to get the message out to everybody out there that foot pain does not have to be scary. Foot pain can be treated, and it can be treated from the root cause so that you don't have to keep coming back over and over again for silly cortisone injections or have to pop pills that are harmful for your body. We want to keep you healthy. We want to keep you active. It's my goal to say, look, I want you to keep playing golf. I want you to keep playing pickleball. I want you to keep running. I want you to do all those activities. Let's keep you going, but let's do it in a safe manner. Let's do it so that you're pain-free, so you can enjoy your life. Quality of life is that's what it's all about here. So, all right, guys, thank you so much. Like and subscribe. Leave comments below. Talk to you soon.